Hi, everyone. I'm Steve here with Jake Covert, chiropractor at our Parkway Athletic Club in South Reno. Thanks for being here, Jake.
Thanks for having me, Steve. Appreciate it.
All right, so chiropractors are unique. And wouldn't you say that they come from more of a functional medical position?
Yeah, totally. And I mean, it's. I think that's kind of the beauty of chiropractics too. Is it's meant to be a more individualized healthcare approach. Essentially, you're not going to an appointment getting prescribed X, Y, and Z medications or therapies for the same thing essentially. And it's. I don't know. I think it's just meant to be more tailored, more personable, and kind of tailored to your individual lifestyle.
So, yeah, it's just a little more holistic, a little more natural. And every chiropractor has different opinions, try different things. I mean, I think there's some chiropractors that try crazy stuff, but they work for some people. Don't you think? I mean, you've probably seen this.
No, totally. Yeah. And and even when it comes down to the technique itself, there's many different, there's a lot of different techniques for chiropractors just of getting the same job essentially done. And even in terms of the modalities, I mean, a lot of chiropractors will use like electrical stimulation, traction therapy, corrective exercise. They come in all shapes and sizes essentially. So it's whatever they specialize in or want to do essentially.
And so you mentioned something that's what we're going to talk about. Does your chiropractor do this? We're going to talk about traction. And I can just say I got one of those little teeter things that I get on and it goes upside down and it stretches my vertebrae.
Mhm.
Um, and if I've injured my back or it's a little stiff, it tends to help me. So is traction something that you use in your practice?
It is, yeah, and traction therapy is one of my favorite modalities to use. I actually just got it's called a Triton decompression table, and I've got that up and running at my practice now. And what that's good for essentially is lumbar or cervical traction. So it's lower back traction, neck traction, and it's used for a lot of different things essentially. I mean, if you just have in general stiffness, tightness, it's great to loosen up your muscles a little bit, get a little bit of the blood flowing. And it can go all the way to nerve related issues, essentially. If you have any sort of shooting pain, numbness, tingling going down your legs or your arms, it it kind of separates your vertebrae a little bit and kind of gives the nerves a little bit of breath, so to speak, and allows a little bit of nutrition and healing essentially to go along to them to slowly make those issues better, essentially.
Do you think a lot of chiropractors use this, and do they use different types of tables?
Yeah, I would say not every chiropractor uses traction, but the ones that do, they come in a lot of different shapes and sizes. I mean, you mentioned the inversion table, for example, and inversion tables are great for at-home use. Like you said, your muscles are a little bit tight and you can get on there with ease. And I mean, they're affordable and easy to use. And I would say that that's great for home use. The benefits of going to a chiropractor or maybe even like a physical therapist for a more advanced traction table itself is that you can precisely uh, limit the amount of force that you need or the separation that you need and even down to the level. And I think that's one of the cool benefits of my table is that I'm able to lift you up and down essentially to target a specific vertebrae for your exact height, weight, size, and age essentially. So if you have an L5 lumbar radiculopathy, for example, if you have shooting pain going down your legs, I'm able to target that single nerve root essentially to decompress that. And then there's other chiropractors that will use a flexion distraction table, for example, where you can even get some side to side movement with it. It won't be as much traction per se, but it really varies. And so it's only about 25% of your body weight that will cause the vertebra to gap essentially initially. So depending on the condition thereafter, you can really tailor it.
Hmm. So tell us a little bit about. You did tell us a little bit, but tell us a little bit more about when you would use this on a patient, and also sometimes you feel that just stretch and just pop a little bit too, right?
Totally, yeah.
People
And
feel that.
Yeah, no, they
So,
do.
so you talked a little bit about how you would target something, but is there any other specifics about how you would decide, or is this something that you do with every client,
Mhm.
um, for, maybe a couple minutes or whatever? How do you use this tool in your
Mhm.
practice?
I would say it's not the first thing that I would do with someone, because being a chiropractor, we're always adjusting people, functionally trying to strengthen maybe some lagging muscles to get them up to speed. But if I have someone that has persistent chronic lower back pain, for example, and I've adjusted them, we've done soft tissue, we've done like core strengthening or any sort of smaller muscle strengthening, and there's still just some persistent pain and tightness, I like to give the traction table a chance there, essentially, because it's your entire life. Everyone walks around, and I mean, if you think about it, you're fighting gravity your entire life. Everything that you do is compression, and you're walking around and you're lifting stuff. So even when you go to the gym, you're inducing more compression onto your spine. So when you can finally have something that decompresses it a little bit, it not only feels great but has a great benefit. And I would definitely say it varies in treatment times with people. Some people feel great instantly after, but I'd say the vast majority of people, they'll notice kind of a mild improvement right after the treatment. And then 2 or 3 days later, I'll get a text saying, like, I feel so much better. This is unbelievable. And so it really, it builds, I would say, is as time goes on, essentially. So I like to do a couple treatments a week if it's indicated and necessary for them. And that usually clears up a lot of chronic issues over time.
Yeah, and, how long is the treatment usually? Is it 5 minutes? Is it less? Or
It varies person to person, but if it's just some simple muscle tightness, I personally don't like to go under 10 minutes. I think 10 minutes is a really good starting point. But if someone really needs it, I would go all the way up to 30 minutes. But past that, I would say it would be too long, definitely too long. So I would personally want to go past 30 minutes.
okay, and you have a personal training background also. Um, so a simple way for people to do this in the gym is just hang on a pull-up bar, right?
Totally. And yeah, and then you kind of talk about the different types of traction, because you have an instrument assisted traction where you can essentially put as much force as you want to traction it. And then you have positional traction. So even if you just lie on your stomach in kind of an upright kind of sphinx position, that is actually considered a positional traction. And so just sitting there can be really helpful, stretching muscles or even getting some sort of extra movement to the discs themselves. But yeah, definitely, if you're doing some sort of dead hang like that as well, similar to your inversion table that you mentioned, I would say that that would have similar benefits. And really, at that point, it just comes down to how long you can hang on for during the stretch.
Yeah, I mean, you're talking about things as simple as just hugging your knee, right?
Exactly. Yeah, and then you can really kind of get into it there of talking about the McKenzie exercises, Williams exercises, and kind of positional decompression varies person to person depending on their preference. I would say the vast majority of people do prefer kind of that extension positional traction, but there is a lot of people that prefer flexion as well. And like what you mentioned of bringing your knees to the chest, which would be more of a Williams style positional traction.
And with your personal training background, I'm assuming that you give your patients exercises, stretches, things that they can do at home, right?
That's always a must for me, essentially, because and that's kind of my philosophy as a chiropractor as well, is someone's coming into me because they have some sort of pain, tightness, or what have you. And so when I evaluate them and intake them, I will try to adjust the joints that need a little bit more range of motion to decrease their pain, increase the range of motion. And then thereafter, you can kind of strengthen in the position of correction, so to speak, because you're able to do all the movements without pain anymore. So it's once we can get there without pain, then we can strengthen there, get those muscles that need a little bit more work up, and then kind of go from there, essentially. And I'll always essentially prescribe some sort of strengthening or core exercise with all of my patients.
Yeah, and everyone out there listening, you can ask your chiropractor about these things. Ask questions. Ask what other treatments that maybe the chiropractor you're going to does. He might have some things that ask them, right?
No, yeah, totally agree. And it depends on your practice. And a lot of chiropractors set up their practices to where it's kind of like in and out and it's really quick. But what I have going at Parkway is a lot more individualized. And I like to sit down, spend some more time with you and really take a look at what is it that you're doing and how can we make this better. And so whether that's golf, whether it's just in the gym, or if that's just picking up your grandchild, like that's it, whatever your goals are, that's what I try to focus on.
Yeah, that's great to be like sports specific. Hey, I'm a golfer. I want to be a better golfer.
Hmm.
And that's where that personal training background comes in. Or I'm a tennis player. How can I be a better tennis player?
Hmm.
Or whatever it is. I want to pick up my kids easier.
Hmm.
Uh, so, Jake, before we go, any last thoughts on traction?
I mean, traction is great. If you have any sort of chronic tight muscles and you've tried a lot of things, I would say it's definitely something that you could give a shot to if it's indicated and if it's safe for you to do. I think people would really enjoy it.
Okay, so you are located at the Parkway Athletic Club in Reno, South Reno,
Mhm.
uh, Double Diamond. I think that's the road, right?
Yeah, Double
Um,
Diamond Parkway. Yeah.
right. And so, what if they want to follow you on social media or reach out, and how can they get a hold of you?
Yeah, you can find me at atlaschiropractic.us on Instagram, and then my website's www.atlaschiropractic.us, and you can call or text me at 775-848-0540.
All right, Jake, we really appreciate you being with us, and we will talk to you next time.
Perfect. Thank you, Steve.